Hi and welcome. Thank you all for joining us in today's very special interview with Dr. Tro Kalayjian. Did I get that right?
Yeah, just Tro is fine.
Tro, awesome. So, hi and welcome.
Yeah, thanks for having me. This is going to be fun.
It is. Can you share with our audience a little bit about your background? Because it is so rare to find somebody who's working in the medical field that is going so against what like 99% of dietitians and doctors are being taught or are working with.
Yeah, so I don't know how far back you want to go, but a little bit about me. I'm a board certified internal medicine doctor. I'm also board certified in obesity medicine. I have a very clear mission in my practice. It's end diabetes, end obesity, and to get people off medications. It's basically it. This is what I do every single day. We've published 5 papers. We're working on our 6th paper, ranging from topics from binge eating to obesity, diabetes, and cholesterol issues. So, me personally, why did I get inspired to do this? I grew up in a family where everybody was obese. We were talking about it before you aired on. We share a similar heritage, and so a lot of paklava and pita bread, and
Oh,
you
stop
know,
it.
and and hummus. So a lot of grains and whole foods. But really, my parents came to this country with very little. They came almost with nothing, and so they worked 2 full-time jobs. And I grew up in the modern food environment. I remember, being a little kid at home and craving food, and I'd get out, Vienna sausages, and my parents would get a bunch of, Burger King chicken sandwiches and put them in the freezer and tell us to eat that if we're hungry, and, get boxes of pizza and just put it in the fridge, just because they, not like when they had the time to cook, they'd make all the dishes that we probably grew up with, stews with spinach and chickpeas and meat, and, rolled dolma and sarma, like these grape leaves. And, anyway, just the bottom line is when they could cook, they would, but otherwise we were relegated to modern food. And then when we went to school, it was modern food. So, of course, by age 8, I was already obese. By age 10 or 11, I was over 200 pounds. My older brother was 300 pounds at that time. And basically, I grew up in obesity, mom with diabetes, dad with obesity and heart disease. This is the environment I grew up in. And I remember being 13 years old and waiting for my 13th annual doctor's appointment, and waiting in this room, for 2 or 3 hours until he could see me. And then he put me on a scale and basically said, you have to eat less. You're terribly overweight. You're 210 pounds, like the same amount I weigh right now. So, yeah, that's kind of like my upbringing. And I struggled with obesity all the way through. I was inspired at that minute. I remember, like, I'm going to become a doctor. I'm going to have treadmills in my waiting room. I'm going to actually help people, unlike this guy who put me on a scale, shamed me, and said I got to eat less, right? I'm going to do better, right? And so fast forward, I go through college, I go through med school, I go through residency, and I gain 10 pounds a year every year. And I'm a 350-pound board certified doctor,
In
right?
obesity.
Yeah, well, not yet in obesity, but always inspired to do primary care and kind of care for the people. And so, yeah, I'd say that was my primordial lose. And finally, my wife, we're pregnant with our 3rd kid. This is like, about 6 or just before she was pregnant with our 3rd kid. My wife, she asked me if I'm going to make it. And, if I'm going to make it, as in, am I going to die young, because of my weight? And she's not trying to shame me. She's just like, are you going to be alive for our 3rd kid? And it was that point where she really kind of inspired me to think about this a little bit differently. So she's like, you're a smart guy. Why can't you go figure this out? If it was pneumonia or an aneurysm, like in my dad, you'd figure out and you'd tell me what to do. You'd look at all the drugs. And so my career really in obesity started with my own journey. I grew up in, a culture of obesity. Everybody in my family was obese. And, I made it med school and residency just furthered me into obesity. And it wasn't for the lack of knowledge or willpower or discipline that I was obese. It wasn't those things. I had knowledge. I didn't have insight. And that's a problem because I was in the Yale system. I scored 90th percentile on my board exam. And they told me, maybe you're stress eating. Nobody explained to me what that was. They said, maybe you're depressed. I took the surveys for depression. I was never depressed. I'm like, I was so disenfranchised. They're like, maybe you're just, why can't you be in a calorie deficit, right? Like just maintain just count your calories. And I'm like, these guys, like I could recite the calories of everything, right? I could tell you a cup of orange juice, egg is 80 calories, a bowl of cereal is 140. I could tell you a cup of milk is 80 calories, right? There's 12 grams of sugar, in a cup of skim milk, right? So like, it wasn't for lack of knowledge. It was lack of insight. And so, I trained with the brightest minds, right? And yet nobody could impart insight on me that helped me sustain behavior change, right? They just said, eat less and move more. Kind of like if you got a flat tire and you call up AAA for help and they're like, listen, guy, just do better, put more air in your tire than you let out. Like that's the equivalent of like, hey, I got a problem with alcohol. Well, just drink less than your body clears it out and you should be fine, right? Like this was the equivalent of the medical dietetics approach to my obesity. Don't do that, right? And so it was lack of insight that really was my problem. And so, and that's not always the case, right? Other people are different, right? There's some people with obesity who have childhood trauma. There's some people with obesity who, have severe genetic issues and those are rare, but, that's possible, certainly possible. It's a complex disease, but in my case, and in most people coming to my clinic right now, it's not the case, right? They just lack insight. And so my wife's like, you're smart, go figure it out, Tro. And so I went to literature. I opened up the books, like why does every medical organization say, eat low fat? I just went and looked. I didn't have any skin in the game. I had no skin in the game. I'm no bias. I'm just a doc looking to see which head-to-head trials are going to be the best. And then you look and it's like every single head-to-head trial, low carb is better. So, and then you go more into the literature and you're like, all this whole grain food pyramid nonsense is just bias and it doesn't make sense. The interventional trial data is very clear. Low carb always does better, not by much, but does better. So I'm like, okay, I just want to use, like if it was antibiotics, I would choose the best antibiotic, right? So that's it. I had no skin in the game. I wasn't the biased zealot, whatever they call me, I'm just like, I want to get the best. I want to start with my best foot forward, right? Because I'm desperate to get out of the state I'm in. And so there was a lot of unlearning that happened. All the stuff on eat multiple small meals, heart healthy whole grains, heart healthy vegetable oil, all the nonsense. It's all there. It's all bullshit. Excuse my language. I don't know.
That's what I say.
Okay, perfect. Yeah, so it's all bullshit. And I read, I probably read 3,000 original articles because I get like that. When I put my mind to something, I want to know it the best. I want to know what I'm dealing with. And I read probably 300 diet books and all the publications in the diet books, right? All the references and all different kinds, all different people, I didn't have any skin in the game. I was just trying to figure out what's the easiest, best way for me, and then I read 3 textbooks on obesity, and that's when it hits me like, this is all a freaking scam. Like, this is the biggest scam pulled over most people's eyes. Portion control is nonsense. It's nonsense. If it worked for you, you wouldn't need, if it worked, because everybody knows about those things. If it worked, right, we wouldn't have an obesity epidemic, but they don't work. Even in the literature, they don't work. Calorie counting zaps people of motivation. It makes them occupied really with things that are not consequential to human eating. It doesn't change behavior in any way. I mean, the data is so clear, portion control, like it doesn't matter if you portion control or you eat less frequently, it doesn't matter, right? Like if you have big meals and eat less frequently. So like the bottom line is if somebody was going to work by counting points or counting calories, they wouldn't be, they wouldn't be the 90% of people that are metabolically unhealthy or the 2/3 that are overweight or obese. They wouldn't be those people because they would just eat less and calorie count and they'd be fine. Right. So
Yeah.
for everybody else, the 70 to 90% who are unwell, right, that advice doesn't work. And I was the one it didn't work for. So that's where my journey started. Really, I was like, I was awakened, like, this is the biggest scam of the century, and everybody's suffering.
Was that before or after you became a board certified obesity doctor?
So once I read it all, I was like, I can't unsee what I've seen, right? Like that's when I was like, I'm devoting my life to this, right? And that was like 2017, I was like, I'm devoting my life to this, right? And that's when I got certification for obesity medicine. So now I'm in internal medicine certified, 90th percentile on my board exam. And then, 5 years ago, roughly, or, thereabouts, 4 years ago, I'm board certified in obesity medicine. And then during that time, I lose 150 pounds, literally never hungry, not hungry, just eating meat, fish, chicken, eggs, Greek yogurt, green leafy vegetables, and sometimes some low carb replacement foods,
Congratulations.
Yeah, it was, that's the thing. I wish I could say it was hard.
Right.
It wasn't easy. It's, once I understood it wasn't the nutrition so much, it was the behavior. And that's a tricky topic. Most people come to me because they're like, you'll tell me what to eat. Most people don't need to know what to eat. They just need to understand why they say, you know what, I kept eating, I ate wrong. I'm going to keep eating wrong and I'll start again on Monday. Why do you say that? Right? Why do you say, I've been done so well, I deserve a treat? Why do you say that? Right? Like they need insight. They need insight as to, when somebody tells them and they have to, like I was obese, 350 pounds, and I wanted to lose weight desperately. And my wife, my poor wife, she'd say, maybe you shouldn't eat that. Like total nice person. And of course, I'd be like, leave me alone. I know what I'm doing. I'm a grown man. Like, don't tell me what to do. I'm a doctor. I want it. Right? How many times have you heard those? Right?
That's
You
hilarious.
probably hear those in your client. So why, like if my wife came to me and said, hey, you got a flat tire, don't drive. I wouldn't be like, leave me alone. I know what I'm doing. I'm a grown man. I'll drive if I want to. I wouldn't say that. So the thing is like people don't need to know so much what to eat. That like, yes, we need to be taught what to eat, but the eating is sometimes the easy stuff.
I
It's
agree.
the other stuff, the behavior and
Yeah.
the mindset, which is so critical. So people come to me, they're like, just tell me what to eat, Tro. Like, I'll follow everything you say. I'm like,
Yeah.
well, eating comes after like the real work.
That's amazing that you say that because literally 80 to 90% of my work with my clients is all mindset work. The easy part for me is to put up the diet and, work on a diet together and stuff. That's the easy part. And so I agree with you wholeheartedly that it's all in the mindset, the way that we view food, why we want to change, what's our purpose, what's our goal. So many things go into that. And I'm so glad that you agree. So let me ask you, since you become a board certified obesity doctor and you're seeing patients all the time, but your content, on Instagram and everything that I've seen is so at odds with probably what they've taught you in school. So first of all, let's start with your peers and colleagues. Do you face resistance? Your medical school, like how has your experience been in that area?
Well, so it's dual. So okay, let's first start. I've been asked to do grand rounds. Cardiology conferences have asked me to do grand round. Talks on weight loss. I've been asked to talk at various conferences. So there's one group that's very embracing. Like, wait a second, right? And I've published studies. So along the way, it's like every time I hear nonsense, like keto causes or intermittent fasting causes food addiction. Well, here's a case series on binge eating. You know, it's weight loss that causes diabetes remission. Well, here's patients that didn't have weight loss and experienced diabetes remission just by lowering carbs. You know, if you have high triglycerides, you can't do keto. Here's 1,000 triglyceride coming down to under, 200. So every time they put out nonsense, I put out a paper, right? Okay. Every time they put out, so I put out, so my life's like mission, I'd say, has been to do better, to be better.
Have you been asked to speak by the Academy of Nutrition and Dietetics?
No, I haven't. So in fact, when I go to, so obesity, I went to Obesity Week 3 years ago. I'll be there again this year. And, it was virtual for the last 2 years, but, they asked me to leave.
What?
They said, we don't want you to, we see that your tone on social media, because that was like the most cited, I'm very active on social media. They said, we see your tone is critical. Are you sure you want us to remain here? So this is what the modern convention is. And then if you look at like the gym bros and the vegans and the calorie people, they all uniformly don't like what I have to say. I've been criticized by Yoni Friedhoff, the Napoleon doctor from Canada. I've been criticized by Spencer Nadolsky, the gym bro from, I don't know where he is now. Lane Norton, all these, kind of mainstream, approaches. Kevin Hall is, we have a somewhat cordial relationship, but I'm sure there'll be criticism coming from him. We just wrote a letter to the other, myself and Eric Westman, to Chris Gardner. So I'm imagining I'll start to hear it from that camp as well. This is par for the course. It's when you do things differently, I'd imagine, and I don't back down. So I'd imagine, they'll come for me. And I say crazy stuff online. Sorry, I'm for
not
cursing.
Crazy. You're spot on, and you have personal experience in addition to intelligence and the academic background to back all of that up, which is far more than you can say for the vast majority of your critics. Because here's the thing, the reason how I came to change my diet and the diet that I work with my clients is because I personally experienced it. Whereas the vast majority of the dietitian friends of mine that we went to school together, most of them were skinny. Most of them never had an issue with their weight. And so it's like, they don't care. It's like, oh, it's just a job. And now they're employed by other clinics, prescribing fructose-laden desserts for diabetic patients. It's like, oh my God, so you have to go through it. You have to apply things on yourself, because the moment you apply it, you realize that 99% of what we've been taught is all been cherry picked. And the vast majority of it comes from the Academy of Nutrition and Dietetics, who is literally in bed with the food companies. I mean, they are one and the same.
Yeah. I mean, well, so if you go into conflicts, it gets very deep very quickly. Not only the corporate, but also religious issues at hand. Yeah. Seventh-day Adventists. Look, the bottom line is I would just tell people to be very critical of the guidelines, right? If you look, I'm critical of a lot of medicine, right? Not just dietetics, cancer, drug approvals, Alzheimer drug approvals. I mean, if you want to know if I support, there's a lot of parts of medicine that are just unnecessarily favoring of industry and not really for the people, right? So the question becomes, it's more of a systemic problem. It's not a nutrition only problem. It's also a cancer drug problem. It's also an Alzheimer drug problem. It's a systemic governmental policy and medical organization problem. And when you have a systemic problem like that, most people, right, if you look at like the Milgram experiments is where they ask people under, the authority of somebody else to do terrible things. You remember the experiments where they asked people to, shock another human in the have you heard of the Milgram experiments or no?
No, I'm very interested. And yeah.
So it was like a fake experiment, right? They brought in people and they said, you're part of a clinical trial. You have to shock, another human, and it's totally safe, and we're testing to see how they'll be. And all they were actually testing was how many % of people will shock another human, right? And you'd be surprised. And they thought at least they were shocking another human. 40% just did what they were told. Like an authority figure comes in with a lab coat and says, shock this person. And they're screaming in the background every time they hit it, but they're saying, no, shock them again. And they're just pressing the button. It's safe. It's fine. Don't worry about them. Just hit the button. So 40% just do it without asking questions.
Wow.
30%.
I would venture that even higher than that, probably.
Well, get this. Another 40% will do it and say, are you sure? And the authority figure will say, yes, we're sure. It's going to be fine. And they'll shock them. Right. So 80% will do as they're told, right? Wow. 80% will do as they're told. Only 20% would stop and be like, I'm not going to do this.
Yes.
Right? There's human suffering. I'm not going to do this. Right? So when you look at science, just think about it. We're selecting people who can go through years and years of this nonsense.
Yeah.
So by the time you get to the end of it, it's 80% of the people there, even more, maybe 90% will just do what they're told, right? They've been studying in the books and doing what they're told for 12 years, right? So of course you're going to get those people. So in science, we have very little questioning people. And you see this, most people see, and I hate to bring up a controversial topic, but you see this with COVID.
Yeah.
Right. You saw with COVID, it's not that vaccines don't work. We give vaccines to people in our clinic who are very sick, right? But before the trial was approved, right, people were saying, oh, I can't wait to give this to my patients off of a press release from Pfizer, right? So they didn't have a published trial to review in a peer-reviewed journal. They didn't have that.
Yeah.
They had a press release, and I can't count how many doctors are like, I'm going to give this to everybody. Like, it's not the problem that they want to help people. I like that about them. It's not a problem that they're willing to, believe that a vaccine will work. Many vaccines work, right? What the problem is we have a bunch of lemmings who were basing how they're going to care for people off of a press release, which goes back to this Milgram experiment. And the same is true. So that's the problem.
By the way, a press release coming from the right arm of those pharmaceutical companies. I mean, the vast majority of those media channels are supported and sponsored by those pharmaceutical companies. That's why for 2 years of a pandemic, when the #1 topic should have been strengthening our immune system and looking at why 80% of those hospitalized with COVID were either overweight or obese, nobody said a word. Nobody touched the subject.
In fact,
it was taboo. We got censored. Yeah.
They did the opposite. So not only did they not, they say, hey, this vaccine may work. We're going to look more into it. They could have said that. They didn't. They said, go get it, and we're going to punish you if you don't. So the problem that happened was, hyperglycemia risk factor. Anxiety is a risk factor for death. Obesity is a risk factor for death. Hypertension is a risk factor for death. What actually happened was free donuts, free Sam Adams, free Happy Meals, free, right? So literally it was, let's give you more risk factors for death, while we encourage the vaccine, which maybe they were thinking, all right, I'm going to help with, I'll give it to them. Maybe they thought that they were doing something noble, but it was disastrous. And correct, for 2 years, the average American gained 20 pounds in lockdown. The average American gained 20 pounds in lockdown, which means they have a higher risk of dying now than they did prior to lockdown. The problem isn't that vaccines may work, and we give it to people who are super sick, right? We have a lot of people with severe obesity, diabetes.
Yeah, that's fine.
Elderly, right? And they come. So this isn't a vaccine question, right? It's not a vaccine. It's a problem with the system.
Yeah.
And the same is true for nutrition. The same is true for Alzheimer's. And you know what? You know it, and I know it. Our dietetics and medical colleagues, they're thin, orthorexic people who've never struggled a day in their life, and they don't question anything.
Yeah. Yeah, I remember just a few days ago, I came across one of the previous spokesperson for the Academy of Nutrition and Dietetics. I even have her name. Like I collect all this stuff for my records, you know, and she was writing articles how orange juice shouldn't be demonized. And it's like, oh, wait, what? Now we're going after orange juice? This can't be right. Because I grew up having orange juice at the table and it had vitamin C.
Oh my God.
Ah,
Yeah.
and that's, you know, those are the kind of people that are heading those organizations, and that are they are influential, and they get to be on those channels that we're talking about. And people, a lot of people, like you said, maybe 80% of us, they just look at authority figures and they just believe them just because it's an authority figure. You know, it's, what is it, like eminence-based
Yeah.
medicine as opposed
Yeah.
to evidence-based medicine. So, yeah.
Yeah, 100%. I mean, you know, look, if I was, Tropicana, okay, what would I want to do? Right? What would I want to do? I would want to take that dietitian you talked about, give a donation to the dietetics organization and say, we really like that person, and we'd love to see them, grow in your company. She's done a lot of great work, right? And that's it. That's all you need to do.
Yeah.
And that's it. You don't need to do much more than that. Just give a little bit of money, say
Yeah.
what you want, and it usually happens. So
And
now the industry gets more voice, and they're a useful idiot usually. They're a useful idiot. They don't realize,
perfect. Spot
you know,
on. Yes.
yeah, they're a useful idiot. They don't realize, like, look, if you want vitamin C, eat a freaking pepper. Like a green pepper is more vitamin C per calorie.
Yeah.
And remember that calories thing they care about? More vitamin C per calorie in a
Yeah.
green pepper.
Yeah.
So what? I don't hear anybody talking about green peppers.
Yeah.
It's always orange juice, which is just filled with sugar,
Filled with sugar.
right?
By the way, the same transporter in your gut that allows the vitamin C entry into your blood is the same one that allows glucose into your blood. So when you're having that glass of orange juice that has gram amounts of sugar and only milligram amounts of vitamin C, how much of that vitamin C can actually cross when it is being competitively inhibited by all of that sugar in that glass of orange juice? You're not absorbing anything.
Bingo, right? It's a bull BS pseudo intellectual approach to eating,
Yes.
right? Okay,
Yes.
it's a BS pseudo intellectual approach to eating. People don't drink orange juice for vitamin C. They drink orange juice because it's full of sugar. It makes their dopamine light up and it tastes sweet, right? And so what you're doing is you're intellectualizing human behavior, which is the problem with dietetics. If you want potassium, don't eat a banana. Have zucchini. More potassium per calorie, 4 times the potassium per calorie in zucchini than there is in a banana, right?
Yeah.
So the problem is calories just count when it supports their narrative, and then nutrients count when it does, and they neglect the calories when it doesn't support their narrative, which is basically shit food inclusionism, right? They just want to include food that's literally addictive, put the responsibility on the person in front of them that they have a problem limiting addictive food, just like giving, painkillers to somebody on opioids, saying it's your problem, you can't regulate it. No.
Yeah.
The human drive to eat is so deeply ingrained, and they're abusing it. They're abusing it. And it's unfair. And these people who are chronically thin, they don't have signals to eat. They can just chill out and, like, they're not hungry. My wife's one of those. I mean, I love her, but she eats half a slice of pizza, saves the other half in tinfoil. I
What?
never met a creature that saves pizza in tinfoil, because when I grew up, like, it was like, who could finish the last piece first?
Yeah.
But people out there apparently save it in tinfoil. She puts it in the freezer. I'm like, anyway, but the point is that there are people who don't have this appetite. And surprisingly, that most of them are dietitians. How many, the average American, like, when you look at dietitians and doctors, over 10 times the normal amount are anorexic.
Really?
Anorexic.
Yeah.
Over 10 times dietitians, particularly, maybe 4 or 5 times for doctors, right, are anorexic. right? How
Right.
is it, right? People who don't have an appetite, people who succumb to, pressures of bodily image, very, very likely to become
Yeah.
dietitian doctors, right? So it's not these people, right? They can't relate to somebody who has an appetite out of control.
Which is 80% of the population.
Correct. Yes.
And
Yes.
that is the tragedy.
Sorry, I'm yapping so much. You got me riled up, Doctor.
No, my favorite topic. That's why we want to talk to you. This is great. I wanted to ask you, when you went through medical school, how much nutrition did they really teach you?
So that's a tricky question. So again, I think the problem is it wasn't my medical school. My medical school taught me about deficiencies very well. Right? They taught me about deficiencies very well. Scurvy, Wernicke's, Corsica, all these deficiencies, right? Pellagra, yeah, everything, right? They taught me very, very well.
Mm-hmm.
They did not talk to me about the psychology of obesity and diabetes, okay? And they did not teach me, right, how to sustain behavior change in humans. Okay, they didn't teach me how to liberate patients from modern medicine, from the need for modern medicine. What they taught me was you can treat the symptoms of modern medicine, right? So the problem is I don't blame, I scored on the 90th percentile on my board exam. They taught me a lot, right? They taught me a lot. Between my medical school, my residency training, chief residency, I was taught a lot, but I wasn't taught how to actually help humans deal with food. And most of chronic disease in the primary care setting is a metabolic health issue that needs to be addressed. I don't know if that makes sense.
Yeah, I agree. And I see the same thing also in the dietetics programs. We're just taught calories in, calories out, and we're taught that the holy grail diet is what the Academy of Nutrition Dietetics puts out, and everything else is a fad diet. And I'm always wondering, why is it that those programs aren't incorporating the root causes? Why do they succumb to what the Academy puts out? Or in your case, the medical associations?
Yeah. So look, I think a lot's changed in the last, 5-10 years, right? So in the last 5-10 years, we have shifted to, we like the 2020, the ADA said, oh, low carb diets work. Like all of a sudden sugar matters for diabetes.
The AHA, you mean? Or the Diabetic Association?
The American Diabetes Association.
Yeah.
2022, the AHA says maybe there's a use for a very low carb diet. So
yeah.
I think now they've come back, like the medical organizations, because of the data, because they've really been forced to. They've had to
into changing, basically.
Yeah, they, with CGMs just made it like, you guys are idiots. Like the minute you have a continuous glucose monitor and you're saying eat oatmeal and, bananas, and a diabetic can tell you that's insanity, right? So they were forced to adopt. So there's some change happening, but the top down isn't changing anytime soon. The nutritional guidelines aren't changing. I doubt it'll be years before the American Dietetics Organizations really endorse very low carb diets. And I think there's such entrenched bias there that it's going to take a long, long time.
Yeah.
That's, if not, your listeners don't know, they're pretty much sponsored by Kellogg's for the last 50 years. Almost exclusively really started from Kellogg's and Seventh-day Adventists. So look, the reality is it's not going to be a top-down movement. It's going to be a grassroots movement, and we have a medical society now. I'm on the board of directors for the Society of Metabolic Health Practitioners. It's a not-for-profit. Our mission is to educate doctors, dietitians, nurses, nurse practitioners, and nutritionists and personal trainers We literally certify physicians. We get them board certified in metabolic health, and we certify these other practitioners. We do grand rounds. The idea is it's going to be us that changes it. It's not going to be a top-down thing. We have to change it. So there's a lot of philanthropic work that I'm doing we need to, plus it's selfish. I need doctors to help me that speak the same language, right? And so it's completely selfish. I need doctors to have a base minimum education in metabolic health. So there's a lot of, that is as gloomy and terrible as it is, there is these bright spots. There are. Sorry.
Yeah, I agree. Yeah, just like everything, we're like on the progressive end of this field. And whenever you're on the edge pushing for progress, you're always going to be the minority. And, eventually the 99% of the rest of the health experts are going to follow, but it's just going to take some time. And right now we just feel like we're lone wolves and looking at everybody like, what is wrong with everybody? But it's only because we have this education, we've had this experience, and others haven't had that just yet.
Look, I think the problem is we're dealing with an authority that said, this is the way, and it was wrong. So we really shouldn't expect 80% of people to believe what we have to believe. We should expect 20% of people, right? And all we can do is just show our success, publish literature, go out and talk and tell people what's going on, and they'll come to us. There's nothing more to do. I mean, look, we're booked out. I have, two amazing health coaches. Amy Igus has lost 220 pounds, kept it off 5 or 6 years now. Ryan Wiley's lost 100 pounds, kept it off for 15 years, doing against medical advice, literally against medical advice. So we have a team. We're hiring another doctor, Dr. Laura Buchanan, and we're booked. Look, we're booked out for months right now. If you wanted to see me, I couldn't see you for at least 2 months, right? Maybe longer. So the point that's
why you reschedule like 3 times. People need to know how busy you are. I've been trying to get this interview for months.
I am so sorry. I want
it's fine.
I want to do it. I saw your before. I saw your before and after. Let me tell you, I saw her before and after. I was like, she gets it. She's been through the same thing I've been through. And then immediately I told my manager, I was like, just book us. Just book us.
Yeah. I'm so grateful that you found the time. That I know how busy you are. Like, you're not just saying it. I know how busy you are.
Yeah, no, look, it's fun to just connect with people doing the same thing. And you get it. We have to hustle on social media, reach people. I mean, there's a PR side to this that people, it sucks that us as professionals, we're both have doctor level education, that we have to hustle online and podcasts and this and that. But, that's just part of it. Why should people believe us? That's why I tell people, I'll give you a CGM. I'll order as many labs as you need. I'll get you a CGM.
Yeah.
You don't have to believe me. You'll see it. You'll see it.
And then I feel like our clients always come to us as a last approach, because every single client that I've worked with is like, I've done this, I've done all the diets, I've done everything. And like, I need somebody like you who understands that this stuff doesn't work. And that's why they come to work with me, like at the end, And I feel like it's probably the same with you.
100%. We are, and we look, these are the people we specialize in just because we're getting them. If you failed every diet, if you're a yo-yo dieter, inability to maintain weight off, you had a bypass and you gained the weight back. I mean, they failed you. They cut out your stomach, right? And you gained the weight back, right? So think about it. They literally cut your stomach and they said to you, this is going to help you. And it didn't get you anywhere. So they're not addressing the root cause, right? What's the root cause? You have to explore that. And I'm happy to get, like I was put here for the sick, not for the healthy. All those dietitians that are like orthorexic and anorexic dietetics and medical doctor colleagues who can count their calories and be fine. They don't need us. It's the people coming to us.
Yeah. Yeah. Well put. And to go back to the gastric bypass and all of those kinds of surgeries, you will never absorb all the nutrients from your diet ever again for life. Not only do you gain back the weight, I think, what's the percentage of people who gain back the weight after a surgery like that?
Yeah, so there's a lot of weight loss in the first year. Uniformly, after 1 year, there is weight gain. Usually by year 10, it's like, they've maintained about 50% of their weight loss. So universally, everybody gains weight at year 1. I mean, they're highly effective surgeries. Okay, they're highly effective surgeries, but everybody gains weight at year 1. Why does everybody gain weight? Why? Because the root cause is not addressed. Now, are they effective? Yes, they're effective because they cause, malabsorption to some degree. So look, the bottom line is do these surgeries work? Yes. Do they have side effects? A lot. Will they address the root cause? Definitely not. Definitely not.
Yeah. Yeah, it's crazy to me that anybody would think that that is actually an option when you have the internet and you have education at your fingertips. And I know there's a lot of misinformation. I understand you need a lot of time to eventually get to people like you and I who are talking about what we're talking about, understand that. But at least, if you persist and after a couple of tries of counting your calories, it doesn't work, look for something else. Eventually you'll find it,
Yeah, here's my quick rule of thumb, because this is the key. Who needs a nutritional approach and who needs a behavioral approach, right? So if you have no food issues, right? If you don't get agitated, like if somebody tells you not to eat something that's unhealthy and you're like, oh my God, thank you so much, you're helping me, right? If you can say that, you're fine with a nutritional approach. If you don't have any guilt or shame, with regards to how you eat, you're fine with a nutritional approach. If you're not like binge eating late at night and, hiding wrappers and, afraid to eat in front of other people, if you don't have those type of feelings, just go straight to nutrition. Cut your carbs. If you're not hungry, don't eat. But for the mere mortals, if you have any of those things that I talked about, a desire to lose weight and cut down on unhealthy food, and yet you get agitated, you feel guilty and shameful, and you have some eating habits that are more compulsive, right? Those are people who need intense behavioral help. That's a quick rule of thumb, right? It's a quick rule of thumb. Who should do something? The other thing is if you have diabetes and hypertriglyceridemia, if you have either one of those, low carb, right? Very clear.
Yeah.
Low carb.
My triglycerides dropped to like 40s the moment I went keto, like an instant. And I always had very high triglycerides growing up in Lebanon, eating, rice and beans and the hummus and all that stuff. My triglycerides were through the roof. And I remember there was somebody who he would prescribe, it was a doctor who would prescribe Atkins. And then when he checked my triglycerides, like, I can't put you on Atkins until you drop it. And it's like, I wish he had taken me on. I wouldn't have struggled so much for years to come until I finally discovered keto and then actually dropped.
Yeah. Do you mind if I ask how high your triglycerides were?
They were like over 150. They were close to 200.
Oh, 200? Like, that's nothing. That's nothing. Oh, it's a clear indication.
I was like 18. Huh?
That's a clear indication to go low carb. So, so the paper we published, because the National Lipid Association, they're the worst. Their leader has called me an embarrassment. So because first of all, I said your guidelines on keto, they put guidelines. What business does the National Lipid Association have guidelines on keto? They said it's contraindicated in hypertriglyceridemia, which is nonsense. It's the most clear way to lower triglycerides. We took people with 500 to 1,000 level triglycerides, and we literally said, we're going to check every week. And we literally showed that low carb, very low carb diet drops their triglycerides. And we published this. And we're like, hey, listen, those, because it's grade 3 recommendation, the National Lipid, which is expert opinion. Now they have to, take into account my data, right? Now they have to. You want to have an expert opinion? We'll deal with my data now, right? And so the same thing, happened. So the the most effective way to lower triglycerides is alcohol restriction and carbohydrate restriction. We've known this for hundreds of years, 100+ years.
Yeah.
And so that's a shame. 200 level is nothing. At 750 and above, I'd worry just a little bit.
Yeah.
Because the risk of pancreatitis, is higher at about 1,000. At a triglyceride of 1,000.
Right. And you will always come across people who have some form of genetic mutation that makes them different than the vast majority. And so those are special cases. But as a blanket statement, for the vast majority of people, the quickest way to drop your triglycerides, not only that, but also your blood pressure, is to go low carb. And I have to literally warn my clients to tell them, be careful, like your blood pressure, if they're taking medication, they have to be very careful, because then you have normal blood pressure, but you're still taking medication to drop it. Now you have hypotension. So, I see this on the regular. So,
look, I'm going to tell you right now that we are very common. We see blood pressure go down with no changes in weight, probably due to fluid shifts. We've published data on A1C going from 12 to 6 with no significant weight loss.
Wow.
Yeah, so it's everything they think they know is just nonsense. It's
Isn't
really
it crazy?
nonsense. Yeah.
In light of this data, you still have dietitians that are prescribing high carb diets for diabetic patients and giving them the insulin and the drugs and the metformin, even though we know that this stuff is like, this should be the first line treatment, but yet, I don't know. Anyway.
You're preaching to the choir.
Yeah, exactly. So, Tro, before I ask where can people find you, where do you find yourself in the next 5 to 10 years?
Yeah, that's a good question. Hopefully with more publications, hopefully with a team of doctors, psychiatrists, cardiologists, GI doc that are all very inclusive of the low carbohydrate approach. Hopefully we'll have 1 or 2 dietitians on board. We already have 2 doctors, 2 health coaches, 1 personal trainer. We have a mental health counselor in the works. So hopefully we'll have more of a team so we can just deliver better and better care. We're moving into employee wellness very, very quickly because we're saving employers money. So hopefully that'll expand. So yeah, I think doing exactly what I'm doing, but in a way where I can, as you said, train people and kind of work with a team, a multidisciplinary team, and just do great medicine.
I love it. So everything you're doing, but at a bigger scale, having more impact and actually getting results.
Yeah, we're going to publish those results pretty soon.
I'm so happy to hear that. Where can people find you?
Yeah, my website, social media, all the same place. Basically, Dr. Tro, spelled out DoctorTro, Dr. Tro, spelled out, drtro.com, social media, any one of those, Instagram, Facebook, all the same.
And you have a podcast I see behind you?
Oh, yeah, we have the Low Carb MD podcast. We have like 10 million downloads. We're top 10 in medicine. So if you have got like, I don't know, 300 episodes. So yeah, that podcast, yeah, that's a great way. So if you can't get in to see me, or I don't know, can't afford me, or too far away, or whatever it is, but we're United States, by the way. We do telemedicine exclusively, remote blood pressure, cuffs, remote scales, remote glucose monitors, remote ketone meters, remote sleep studies. So we literally take care of people all over the United States completely remotely. But if you can't afford me, or you can't see me for whatever reason, or I'm too much of a punk for you, you can just listen to me on the Low Carb MD podcast.
How about internationally with telemedicine? Do you see anybody outside of the States?
The problem is outside, we're going to soon work with a Canadian practice. So hopefully that works well, that we can incorporate this. But it's tough because I don't have a license outside of the United States. So,
right.
You know, I get people who are like, "Can you help me? Can you review my case?" And I'm like, "I can review it, but it's like you're tying up my hands, and I can just give you info, and I have no ability to do what I need to do."
Yeah.
So I don't do them because it's not going to serve it. It's, you know, I've taken select, like, just education cases. Like, I'll review your case because, you know, you're in a bind and you want a second opinion, but I
Yeah.
can't I can't provide any insight. It's just education. So I
Yeah.
don't really do international.
At the moment, you could always hire some doctor from, whatever country, right? And they would work for you. I think that will work.
Maybe we'll bring you on and you'll help me go to, you know, 100
There you
countries.
go. That if YouTube doesn't work out, I have got my plan B.
Yeah, there you go. Perfect.
Awesome. Well, thank you so much. This has been so informative. I'm so glad that we got to do this and we got to connect with you and you sharing your message with my audience. Is there any last minute message you would like to end with?
No, just thank you. Thank you for having me on. And I know you struggled. That's a big thing. Like, you weren't, you didn't just wake up and have genes that made you healthy. You had to work. And so whenever I see that, I'm like, I want to connect with that person.
Thank you. Yes,
Yeah.
definitely a lot of work. Thank you
And on
so
top
much.
of that, you're a doctor, personal trainer, dietetics, I mean, like, you got it all. So
All the stuff.
yeah.
And that's just the stuff that you get a degree for. I feel like 99% of the stuff that I've learned have been from books, podcasts, interviews, and just really educating myself.
Yeah, 100%. Me too.
Yeah, yeah, I can see that. That's the only way that we can understand what we're talking about and promote the low carb message. So again, thank you so much. And thank you everybody for sticking with us till the end. I hope you enjoyed this content. If you did, make sure you give this video a thumbs up, subscribe, and hit that little notification bell icon so YouTube alerts you every time I post a new video. Thank you all for watching, and I will see you in the next one.